Today we are going to discuss the difference between motivational interview versus motivational enhancement therapy. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be defining what is motivational interview, what is motivational enhancement therapy, what are the difference between the two will be discussed in this video. Let's understand what is motivational interviewing. The motivational interview was the original concept given by William R. Miller in 1983. He brought this framework for substance use disorders, especially alcohol disorders, in 1983. Over a period of time, William Miller and Stephen Rollnick added some important ingredients, broadened the original concept, and adapted motivational interviewing to motivational enhancement therapy. That is, the adaptation of motivational interview is motivational enhancement therapy. Motivational interviewing is a client-centered directive therapeutic technique or an approach to enhance readiness to change by helping the client to explore and resolve ambivalence. Motivational interview is a technique or a skill or an approach which is developed to help the people to work through their ambivalence to change their unwanted behavior. That is what William Miller in 1983 brought in. Motivational interview is normally a brief sessions which are given in 15 to 30 minutes. It can be delivered anywhere, any place, inpatient, outpatient, office, or in the community. It is freestanding intervention, or else it can be a prelude to other therapies or treatment. It has a common to combine the clinical method of motivational interviewing with other therapy. In this regard, William and Rollnick came up with the adaptation of MI, that is motivational enhancement therapy. Let's define motivational interview. In simple definition, motivational interview means it is a collaborative conversational style for strengthening a person's own motivation and commitment to change. Let's look at the clinical definition. Motivational interviewing is a person-centered counseling style of addressing the common problem of ambivalence about the change. Let's look into the technical definition. Motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for and commitment to specific goal by eliciting and exploring the person's own reason for change with an atmosphere of acceptance and compassion provided by the therapist. If you break down this definition, the motivational interview is a collaborative approach. It's a client-centered. You are going to respect the client, and the client will decide, or he has an autonomy to decide which is the goal which he wants to achieve. During this process, the therapist will provide an atmosphere of acceptance and compassion, helping him to uncover his resources of change and bring in change with regard to unacceptable behavior. Now let's look to procedure of motivational interview technique. As I mentioned, MI techniques are brief, 5 to 30 minutes, any place, deployed in the patient when he shows resistance or ambivalence to change. Number of sessions, there are no specific number of sessions here in motivational interview, can be used in busy OPD. And we should not employ MI whenever he has a severe dependence and where he requires detoxification, severe withdrawal is there, severe mood symptoms, psychosis, and antisocial personality disorder is there, then MI will not work. MI technique to be used along with other psychotherapies where the behavioral changes has to be done. For example, a person is refusing to do CBT, motivational interview technique should be used or an approach should be used. It can be utilized even in lifestyle diseases, changes which has to be brought in. For example, somebody has to lose weight. Motivational interview can be chosen to bring in changes in their behavior. Advantage of motivational interview is any setting, no time limited, busy OPD, integrated in a routine assessment. Anyone can learn this motivational interview, deployed when the patient shows resistance or ambivalence to change, can be used along with the other therapies. And disadvantage is that you cannot use in delirium, dementia, When the client is agitated, violent, actively suicidal, severe withdrawal is there, severe mood symptoms, psychosis, ASPD, and in treatment seeking or motivated population samples, brief intervention were no more effective than the control conditions. That's what the research says. Now let's move into motivational enhancement therapy. In motivational enhancement therapy, motivational interviewing is one of the component. That is, motivational interview is an approach where motivational enhancement therapy has a structure, time limited, and involves using the frames approach to bring the change in the behavior of the client. Motivational enhancement therapy is time limited 4 to 6 sessions with a defined protocol, each session lasting for 45 to 60 minutes. It is primarily to enhance and maintain and bring in behavioral change in the client. Session 1 is regarding the assessment, gathering information about the unwanted behavior. Was there any attempt to quit? What are the reasons for relapse? Whether the client is ready to change, who brought him for the assessment. Session 2 is mostly focused on building rapport and providing feedback. The providing feedback will be based upon various investigation done, and you need to focus on the current behavior problem rather than focusing what may happen he continues to smoke or drink. You need to use open-ended questions, reflective listening, and empathy has to be used to bring in the changes in the sessions 2. Session 3 focuses on enhancing motivation and developing discrepancies so that the client starts working towards the change in his behavior. Session 4 talks about strengthening the commitment and planning for change, supporting the client in identifying the change strategies, giving him various menus to bring in change, reinforcing the self-efficacy so that the self-esteem increases and he starts for working towards the change of behavior. Session 5 is consolidating and preventing relapse. Here, the therapist will review the progress, address the barriers to long-term change, strengthen the coping skills, building relapse prevention strategies, emphasizing the continued self-motivation and resilience. Let's look into the 4 important processes as given in this picture. The 4 important are, first one is engaging, second one is focusing, evoking, and planning. Let's look into the engaging. Engaging here is developing rapport and having connection and trust with the client. In this process, you will use ORS technique or SCORE skills. These core skills are open questioning, affirmation, reflective listening, and summarize. You will remember by ORS. By asking open-ended question, the client will uncover his problems over a period of time. Affirmative sentences should be used. Reflective listening has to be developed and summarize whatever you hear from the client. Moving to the second step, focusing. Negotiate an agenda and use ask, tell, ask technique. Here you will ask the permission to discuss about the substance use. Ask open question, what do you know about the alcohol use? And next closed question is, how much do you drink? And tell the information. Use the test to show what are the difficulties he's giving by giving feedback, advice, and finally listen to appreciate, reflect, and summarize. During this process, if the client refuses to discuss about alcohol, do not pursue or confront the client. Let the client decide which one is the goal he wants to choose. And by doing this, it's a collaborative work. Do not confront. Do not advise. Do not argue with the client. Let the client choose his goal, and then he will focus on the behavior which he wants to change. Moving to the evoking. Here you will be focusing more on the change talk rather than the sustained talk. Change talk are desire to change, ability to change, reason to change, need for change. And finally, commitment, activation, and taking steps. You can remember this DARE's CAT. D for desire, A for ability, R for reason, N for need, C for commitment, A for activation, T for taking steps. This is how the behavioral changes occurs by evoking. And finally, the planning. Without a plan for change, the motivational enhancement therapy will fail. Hence, you need to have a specific plan. Without specific plan, therapy will not move further. Hence, you need to have a specific action plan which has a greater chances to succeed. Hence, you need to use the visual analog scale to ask how confident are you about to plan to take action. Let him choose between 0 to 10. 0 is no, not at all important to change, and 10 is very important. He may choose 4. If he choose 4, you need to now reflect by asking, why did you pick the number 4? You could have chosen 0, 1, 2, 3. You have chosen 4. Let the client argue why he has chosen 4 and why he needs to change the current behavior. Now fix the goal. In doing the fixing the goal, let the client choose what he wants to be in his life. And that should be long-term goal and short-term goal. Short-term goal should be specific, measurable, attainable, realistic, relevant, and time-bound. The long-term goal is to successful businessman. To be a successful businessman, you need to do certain things. You need to ask, what is that successful businessman? And he needs to break this, that opening a shop or investing in certain business. Now further you have to make it into a short-term goal. To become a successful businessman, now he has to attain short-term goals. There may be many short-term goals before he reaches the long-term goal to be a successful person. So at this point of time, he needs to earn money to invest. Earning is specific now, which is measurable, which is attainable, but have a realistic goal. To achieve maybe 50 lakhs, you need to have a short-term goal of earning 20,000 per month. That is, which has to be realistic and time-bound. So this SMART goal plays a very crucial role. Do not choose a goal which is not attainable, which is not realistic. The therapy will fail. Hence, in a SMART goal, you need to have a short-term goal and a long-term goal. Short-term goal need to be discussed and the client should agree, which is specific, measurable, attainable, and realistic and time-bound. Now let's differentiate between motivational interview and motivational enhancement therapy in a table format. If you look at the definition of motivational interviewing, a client-centered directive counseling style aimed at resolving the ambivalence and enhancing motivation, whereas motivational enhancement therapy is a structured, time-bound, designed to boost intrinsic motivation with a personalized feedback. The goal is to explore and resolve ambivalence in motivational interview, whereas in enhancement therapy, to enhance commitment to change. Here, the structure is flexible, adaptable, any number of sessions, whereas in motivational enhancement therapy, it is fixed protocol 4 to 5 session. Session is open-ended and exploratory, client-driven in motivational interview, whereas in enhancement therapy, guided, structured, and feedback-driven motivational enhancement therapy. Feedbacks given in MI will be reflective listening and open dialogue, whereas in MET, personalized feedback will be given. Assessment does not necessarily involve formal assessment in motivational interview, whereas in motivational enhancement therapy, there is a thorough comprehensive assessment has to be done. In therapeutic tool, DARES and ORS are used in motivational interview, whereas in MET, frames model will be used. That is, feedback, responsibility, advice, menu of option, empathy, and self-efficacy. Focus in MI will be exploring and resolving the ambivalence, whereas focus in MET will be enhancing readiness and commitment to change. The population in MI will be broad range of behavior. MET will be with regard to substance use disorder. Change talk, you are going to use DARN, CAT, desire, ability, reason, need, and commitment, whereas feedbacks and building discrepancies will be used in MET, and in MI, it is a short term or a long term whenever it is required, whereas MET is time bound 4 to 5 sessions will be used. Here in MI, ambivalence will be resolving ambivalence, and whereas motivation enhancement is in MET. Therapeutic role is a collaborative guide, whereas in MET, directive coach can become. Directive coach being the directive and guiding the change will be used. Relapse prevention, promoting ongoing self-exploration, providing relapse prevention strategies is used in MET. Outcomes enhance motivation, strengthens commitment and readiness to change. These are the difference between motivational interview and motivational enhancement therapy. Let's give the tips for therapists, both in MI and MET. Do I listen more than talk? If you are listening more, that is good. If you are talking more, it is wrong. Do I keep my self-sensitive and open to the personal issues, whatever they may be? Or may I talking about what I think the problem is? Do not argue or confront. That is very essential. So you have to keep the sensitive issues to yourself. Let the client uncover the problematic behavior. Do I invite the person to talk about and explore his or own idea of change? Or else you need to give the advice, avoid that, giving conclusions. Invite the client to explore and uncover his problems. Do I encourage the person to talk about his or reasons for not changing? Yes, that is very essential. What are the difficulties he is facing and why he is unable to change has to be discussed. You need to ask permission to discuss and give feedback. Without asking the permission, do not give any advice or feedback. Do I reassure this person that ambivalence to change is normal? That means ambivalence and resistance, you need to accept as a therapist yourself, and you need to assure the client, yes, this is the way for the change. Do I help the person to identify success and challenges from his past and relate them to present challenge? That is very essential. If the client has been successful and fought many battles in his life, that needs to be highlighted to improve his self-efficacy and self-esteem. That is the way to go forward in the therapy. And you need to seek to understand and empathize the person. If you do not do that, the therapy will fail. You need to summarize the patient's thoughts, feelings, and what he is going through. You need to reflect the inner world of the client. That is, accurate empathy is very essential. Do I value the person's opinion more than my own? Yes. That's very essential in MI and MAT therapy. You need to value or respect the autonomy of the client rather than imposing your values or change behavior what is required. The client needs to uncover his own resources to bring in change. Do I remind myself that this person is capable of making his choice? Yes. You always have to respect the autonomy of the client and believe the client has the resources to change. To conclude, my dear friends, motivational interview is flexible, client-centered counseling style or an approach which explores ambivalence and fosters motivation. Whereas motivational enhancement therapy is a structured, time-limited that uses personalized feedback to enhance motivation and build commitment to change. Although both motivational interview and motivational enhancement therapy are often interchangeably used, but both are different. Motivational interview is an ingredient or a component of motivational enhancement therapy. That means it's one of the component of MET. Both are not same. While both approaches enhances motivation, MET follows a standardized protocol with assessment-driven feedback, whereas MI is more fluid and adaptable. MET is used for substance use disorder, while MI is used as a broader application across various behavioral issues or lifestyle problems which needs to be changed. So motivational interview will be used there. MET is specific for substance and MI is specifically for any lifestyle changes to be done. Thank you very much for giving your valuable time. Stay safe.